Hello, my name is Marta Roxberg and I work as Senior Partnerships Manager with FET, or the Tropical Health and Education Trust. I'd like to start by welcoming you all to this webinar, which will focus on the Africa Grants Programme. So hopefully after an hour of this webinar, you will know everything you need to know about the Africa Grants Programme itself and the call that we released on Tuesday last week. So apart from myself, I'm also joined by my colleagues here at FET, Paris Tuo, who is our grants officer, Sophie Pinder, our monitoring, evaluation and learning officer, and Salman Shear, who is our grants and finance officer. So during the next hour, we will cover the following. So I will start by giving you an introduction to the Africa Grants Programme and the call itself. And Paris will briefly outline what was achieved during the previous Africa Grants Programme. Then Sophie will take you through the application form, and Salman will provide details on the budget template and how to fill that out properly. And we will also take you through the steps of the application process, from when you submit your application to the review process and award. And then hopefully we'll have about 30 minutes to answer questions that you may have. So the Africa Grants Programme, or AGP, as we call it for short, is supported by Johnson & Johnson, which FET has been working with since 2012. And this call is actually the second round of grants under the Africa Grants Programme, but we have been working with Johnson & Johnson since 2012. The aim of the Africa Grants Programme is to save and improve the lives of women and children, prevent disease in vulnerable populations, and strengthen the health workforce in Africa. And then there are more specific objectives that we'd like to achieve to achieve our aim, which is training and capacity building of health workers in low and middle income countries in Africa. And FET's approach to do that is through partnerships between organisations in the UK and Ireland and their counterparts in Africa. So the Africa Grants Programme, with its focus also on Ireland and not just the UK, is wider in its reach. And these partnerships implement projects that support improvement of standards of clinical training and technical skills of health workers, or the efficiency and capacity within the healthcare systems themselves. And often these projects involve volunteering, UK volunteers and Irish volunteers providing health expertise to projects, but it could equally be volunteers in the low and middle income countries in Africa. So without going into too much detail, there are two main grant streams under the Africa Grants Programme. One is on surgical and anaesthetic care, and the second one is on community health care. The surgical and anaesthetic care is around measures to ensure safe surgery and quality care for patients undertaking surgery or anaesthetic care in low and middle income countries in Africa. And so that could be about trainings, it could be about improving checks that you have before surgery, or training anaesthetists to provide safe anesthesia. And then the second stream is around community health care. And so that's about working with community health workers to improve health services in the community, and that could be clinical officers, it could be traditional birth attendants, or general community members that have been trained to provide basic health services and referrals to hospitals or other health facilities within that community. But the main focus for the Africa Grants Programme is on what we call underserved populations, and that is vulnerable groups, women and children, or disabled populations, or other groups in country that do not have as easy access as other groups. So my colleague Paris will take us through the projects that were funded in the first round of the Africa Grants Programme, and that will give you a flavour of what type of projects this includes.
Thank you, Marta, and hello everyone. My name is Paris, as Marta just introduced me. So I'm just going to go through the 7 projects that we awarded AGP grant in 2016. So the first one is a community health support for disabled children in Molo district in Kenya, and the partnership, so Paris and Molo Health Link have worked together since 2007 with the aim to train and develop health workers' capacity to identify and support children and their families, enabling their inclusion in the community life. And the project was able to achieve training 139 community health workers who helped to identify disabled children in the local community, and 672 children were subsequently identified and signposted to appropriate support by trained community health workers. In addition, the project held community awareness sessions and formed support groups for the disabled children. The second project I will go through is the Safe Anesthesia project in Malawi. And the partnership have worked together for over 10 years, and the project aimed to increase the capacity of anesthesia providers to deliver safe obstetrics and anesthesia care in Malawi. During the project, they were able to train 117 anesthesiologists and providers across 10 facilities, and trained 7 as trainers. The project was able to reach 6,442 patients, which is really remarkable. And then we have the palliative care project that was in Mauritania, and the partnership have been working together since 2014 and trained 86 health workers who helped to increase the capacity to provide basic palliative care in Mauritania. As a result, the project reached 25,000 people across, including elderly and pregnant women. Then we have the maternal and child healthcare service that was in Cambia, Sierra Leone, the partnership began in 1992 with the aims to strengthen the capacity of maternal and child healthcare services at primary health unit in Cambia district, Sierra Leone. The project provided training and support to 193 health workers, including maternal and child health aides. As a result, 67 peripheral health units demonstrated improved maternal and child care, and 27 trainers are now delivering training independently to the other health workers in the district. Then we come to the primary trauma care program in Sudan. So the partnership have been working together for, I think, over 10 years, and the project aimed to implement a self-perpetuating primary trauma care teaching program for Sudan. Currently, Sudan's road accident rate is 33 per 10,000 population. Road accidents are responsible for 3.6 of all deaths, totaling 9,312 in 2014. The project, through the project, 226 health workers have been trained in primary trauma care across 6 hospitals and treated 600 trauma patients. 31 trainers are now delivering primary trauma care training locally. And then we come to the Improving Anesthesia Safety in Northern Tanzania, which was led by Lifebox and Kilimanjaro Christian Medical Center, who have been working in partnership since 2012. The aim of the project was to reduce surgical complications and mortality by 40% by training nurses and anesthesia providers, distributing vital equipment to KCMC and surrounding hospitals, and implementing the surgical safety checklist. As a result of this project, 192 health workers were trained, including 13 as trainers, and 107 pulse oximeters were distributed across 7 healthcare facilities. The equipment is now being used for all surgical procedures at KCMC. And the final project I'll talk about now is the project that was working to transform maternity care in rural Uganda. So the partnership worked together to improve the quality of maternal and neonatal healthcare in rural communities through directed training, reducing the number of maternal and newborn death and illnesses. As a result, 76 local health workers across 20 health facilities completed midwifery training and reached 14,400 patients by the end of the project. Thank you very much.
Hi everyone, Sophie speaking. So I'm just going to take you through an overview of the current call that's open, the Africa Grants Programme 2017-2019. So you might want to refer back to all the call documents that have been advertised on our website, including the call for, I'm just going to show you where it is on the website. So on the website, the call is open. It's been open since the 3rd of October, I believe, and it's going to be open until the 12th of November. And you can download all the documents that you need to fill in an application and to learn more about the call. The call for applications document, the grant application form, which is kind of the narrative section that you need to apply for, and the budget template to give us an idea of how much you're planning to spend. I also strongly encourage you to also download and closely refer to the Q&A document, which has much more detailed information on the call and some very helpful examples of the type of projects that are both eligible for the grant and also good examples of how to fill in your application. So going back to the slides, oops, sorry. So for this new call, projects can be a minimum of 6 months to 16 months. So for those of you who remember the first round of Africa Grants Programme funding, projects could only be for up to 12 months. Well, this time we decided to extend it to up to 16 months to leave enough time for projects to successfully implement the changes that they're planning. So that means that projects will be expected to start from the 1st of January 2018, and they will all project activity will need to be completed by the 30th of April 2019. In terms of the funding available, we will fund projects between £15,000 and £50,000 per grant. So they're quite a small budget. And projects must operate in low and middle income countries in Africa, but there's no specific priority countries per se. So you'll need to submit your application, which is the application form, the budget template, by email to us by midnight on the 12th of November 2017. So moving on to, so before I talk a bit more detail about the application form, just like to run through the eligibility criteria for this call. So as Marta already mentioned, the project must fit within the parameters of either the stream 1, which is the surgical anesthesia care, or stream 2, which is the community health care stream. and you'll have more information about those streams in the call for application document and the Q&A document. The funding that I've already mentioned, and also the focus on low and middle income countries in Africa. In terms of partnership eligibility, so we're looking for partnerships to apply. So a minimum number of institutions, organisations involved in a partnership is obviously 2, one based in the UK or Ireland and one in the low and middle income country institution in Africa. So we don't accept applications from single organisations. Well, you can apply, but you won't be eligible. And then finally, what kind of institutions are eligible for the funding? So as mentioned, you'll need a UK or Irish lead partner. So the partner can be a charity that's registered either in the UK or in Ireland, involved in health education or health delivery, or a UK and Irish health delivery institution, such as a hospital, health education institutions like a university, or a professional association, such as a Royal College of Midwives, for example. And the same applies to the lead partner in the low and middle income country. Right, so moving on to the project and the partnership criteria. So they're up on the screen and they're also included in the call document. So these requirements form the selection criteria for the projects and the partnership. So the review committee will be assessing each application systematically against each of these points. And in the Q&A documents, you have a more detailed explanation on what we mean by these points. So I do strongly advise you to read it. I also recommend that you keep these points in front of you when you draft the application. You can use it as a checklist to kind of make sure that you're covering all of the points in the application. For some of the criteria, it's going to be quite obvious which section it's relevant to in your application form, but for others, we'll look at assessing it throughout your application and also your budget template. So now I'm just going to open up the application form, which I hope you've already had a look at. So we advise you to complete the grant application form, the Word document that's on the screen, before you fill in your budget, just so that you have a sense of how to fill in the project total amount. It's not a bad idea to ask a friend or someone to kind of read through your application just to make sure that it's 100% clear, that it makes sense, and that you've responded well to the requirements. The summary details section is pretty straightforward to complete. I would advise you throughout your application to avoid the use of acronyms, or make sure that you explain them, as the person reviewing your application might not be familiar with your specific area of work. Right, so duration. So projects can start from 1st of January, but obviously it depends on the length of your project. So as long as they have to be completed by the 30th of April 2019, but if your project is less than 16 months, it could potentially start at a later date. The partnership section, so in addition to kind of just partnership details and this kind of tick box exercise which helps assess whether your partnership is eligible, it's really an opportunity for you to let us know kind of what's the history of the partnership, how it was established, what you've achieved together. You can also let us know of any funding you've received in the past, whether it's with VET or another organisation, and tell us kind of what you've done with it. And this will help us assess the capacity of the partnership to deliver this project. In the justification section, so here we're looking for information around the need and the need for your project and what you're planning to do. So the first section, 3.1, is around the approach that you use for the needs assessment. We're looking to assess whether your research and methodology is appropriate and relevant to what you're proposing with well-evidenced needs. For section 3.2, describe the need that was identified. Please, I mean, a good way to do it is to really make sure that you're covering each of these 3 points around the contextual issues, the operational environment, how the needs is aligned to government priorities and plans, and also any specific barriers that may prevent women, children, and underserved communities benefiting from the project, and how you're attempting to address this. Bearing in mind, as Marta said, the overall purpose of the Africa Grants Programme is to reach underserved communities. Okay, so in section 3.3, we're looking at more information on how your project is relevant and appropriate to the local context. So make sure you describe your project, give an overview of what it's about and how it fits the local needs. In section 4, project description. So those of you who will be familiar with drafting applications for funding, either for the Africa Grants Programme or the Health Partnership Scheme, will know that this has changed. So we're not asking you to complete a project plan, a full project plan at application stage. We're just asking you to give an overview of the changes that you expect to see as a result of your project activities, both at the middle of the project and by the end of the project. And there are some specific examples of this in the Q&A document. Please don't forget to fill in to specify your project goal, because it is sometimes missed out in applications. That said, you might be asked, you probably will be asked to complete a much more detailed project plan with specific indicators should your project be awarded funding. Right, so then there's an activity section, just to describe your activities. Then we also have a section around asking you to disaggregate data on your proposed project. So what are your targets in terms of number of health workers trained, number of trainers trained, number of patients, volunteers, etc. So these can be estimates. Right, and so section 5, project management support. So the information you provide will help us assess your partnership's capacity to deliver the project. And please note that if your project is shortlisted and awarded funding, we will ask you to provide supporting evidence of this, for instance, copies of memorandums of understanding or letters of agreement with the different institutions that you're working for. And 5.2, asking you to describe the different roles of the different partners and how it will benefit them, because the idea of the partnership is that it will benefit all the partners involved, whether they are in the UK, Ireland, or in Africa. And I advise you to have a look at our principles of partnership that are available on our website that give some hallmarks of good practice for health partnership work. Then the other sections, just make it clear whether you're sending short-term, long-term volunteers or a mixture of both. And we're also looking for information on how the projects will benefit any volunteers that are involved. Also looking for information on how you're planning to kind of recruit and manage the volunteers, and whether you have the structure in place to do it, such as duty of care, volunteer recruitment management policies. And there are also resources available on the website that could be helpful for you to look at in terms of volunteer management. Right, and then I'm now going to pass you on to my colleague Salman, who's going to talk you through the budget template.
Thank you, Sophie. Hi, everyone. This is Salman, and as Sophie said, I'm going to briefly take you through the budget template for the Accountable Grant Program application. And just also something that Sophie mentioned earlier is that we recommend that you do the narrative part of the application first, where you can set out your changes and your activities, and you can determine your activities and then approach the budget template once you know what your activities are. And so some of you who might be familiar with the previous grant call, you'll notice that this template has been updated, and this is so that applicants and reviewers have better visibility of the budget allocations as per the category, and whether you're within the budget limitations. And so at the bottom of the template you have a budget category summary, which will make this clearer, and just for information that this section is locked and it contains formulas and should populate automatically as you're completing the main section above. And so the budget categories remain largely the same as a previous grant call. So you'll notice that they still include sections for project management, equipment and refurbishment, travel, and monitoring and evaluation. And the main change is project activity. And so this new category replaces what was previously training and capacity building. And this represents the activities which you're proposing to undertake in order to achieve the changes that you set out in your application form. When you're completing this section of the budget, please try to specify each activity in column A, as per the example on the slide at the moment. And then in column K, which is a notes column, you can provide a greater description of the cost related to this activity. And these activities should correspond with the activities that you have stated in your application form, in the narrative application form. So yes, in the budget template you can start by entering your project details in the top right of the sheet. These include the name of the lead UK partner, the title of your project, and who will be completing the budget. So in the main section of the budget, you will need to populate column C with the cost per unit, column E with the number of units, and provide any relevant details in column A. The total column and the percentages should populate themselves. And as previous funding calls, your project management and equipment costs should not exceed 20% of the overall budget, and you should be able to keep track of this through the budget summary, which we covered earlier. Okay, so that's it, and I'll now pass you on to Paris to go through the application process. Thanks, everyone.
Hello again. So I'm just going to go briefly over the application process. So please email your application form and budget to agp@thet.org by the 12th of November. So all we're asking for is just the application form and budget. Please do not send anything else, and make sure that you send your budget and application form in the templates that we've provided to you, because if you do so on another format, we will not be accepting it. If you do not receive acknowledgement of your application within 48 hours, please resubmit your application, and please bear in mind that we will get a lot of applications, so if we don't respond to you straight away, don't be concerned. Just note that if we don't respond to you in 48 hours, okay, that please resubmit your application. And so the application review process will be, you'll have internal THET staff who will go through the application, and that'll be the first review. And the second review for applications that are shortlisted will be reviewed by internal team and external panel. And applicants will be notified of the outcome in December 2017. So the shortlisting process is, just because you're shortlisted does not guarantee that you'll receive funding. We will be shortlisting applicants where we want to get some more clarification, some more information on what you've submitted. Shortlisted award applicants will be asked, as I said, to provide support and documentation, which could be MOUs, letters of support, and if the budget that you submit is not comprehensive, we will ask you to submit that again. And if successful, then you'll move into the contract stage. And we hope to start the grants by the 1st of January 2018, with inception meetings to follow in the end part of January. Thank you.
Thanks, Paris. So we've got about 30 minutes left for the Q&A session with any of you that have any questions. Can't guarantee that we'll be able to go through all of them, but if not, we'll hopefully be able to answer any questions by email after the webinar. Please also note that we're recording the webinar, and the recording, both the audio and the slides, will be available on our YouTube channel and website either today or tomorrow, and you'll be able to circulate that to other people who are interested. So I can see we've already received quite a few questions through the Q&A chat. So just to let you know how you can ask a question to us. So you have to use the Q&A section that is that should appear on your screen. You can also use the chat function. We'll be monitoring both. We'll just read out the question and answer it. And any question that we can't answer straight away, we can follow up by email. So please do type any question that you have for us, and we'll start answering them now. So we have a question from Fanny Bessem, who says that our organisation is purely health focused, and this grant objective matched perfectly with our work. Can we apply without a partner organisation? So Fanny, you will need to apply with a partner. No, as I mentioned in the eligibility section, a single organisation can't apply. So you'll have to have an organisation that you're partnering with for this project. I don't know whether you're based in the UK, Ireland, or in Africa, but you'll have to have a lead partner organisation in the UK or Ireland, and also a lead partner organisation in Africa. Oh, you're in Cameroon, yeah. So you'll need a partner organisation in the UK and Ireland.
So I have a question from Jamie Duke. Can I just confirm what should not exceed 20% of the budget? So this is your project management costs and equipment and refurb costs. They should not exceed 20% of the overall budget. And again, you should be able to keep track of these using the budget summary at the bottom of the template.
We have a question also from Obina Olerib. Apologies if I'm not pronouncing it properly. So the question is, can a low and middle income country group partner with an individual when applying for the Africa Grants Programme? Unfortunately, we will only accept applications from institutions or organizations. So if you're a low and middle income country group, that can be considered an organization or a professional association or a health institution of some kind, and that's fine. But you'll also need to apply together with a UK counterpart, so a UK health organization or health-focused institution, so a hospital or an academic health institution or a professional health association.
To add to that, also detailed in the call is the different responsibilities that we expect from different partner organisations. So the UK or Irish lead partner will be the contract holder with us. So yeah, it's very important that you have a lead partner in the UK or Ireland. Okay, so I'm just looking at. We have another question from Jamie Duke. We applied last year and got through the second stage. Can we come back to you for further feedback on that application to help us with a new application this year? Well, Jamie, if you applied last year and got to the second stage, you should have received a letter with hopefully some helpful feedback on your application. We can't really help you beyond kind of answering questions around eligibility, because we need to be impartial. We can't because of the selection process. So you know, you can try and ask questions, but then we might not be able to answer all of your questions because of that. I've just realised that there is a function for attendees to let us know if they've got a question by raising their hands. So, which is basically you click on a hand icon. So what I'm going to do is I'm going to unmute some of these so that they can ask their question. So we've got a question from Colette. So Colette, I'm going to promote you to panelist and unmute you, and you'll be able to we'll be able to hear you. Hi, Colette.
Hi.
Hello.
Hi. How are you?
Very good.
Are you hearing me?
Yes.
Yeah. Okay. I just want to know if you have any possibility to join us with a partner in UK.
Oh, to link you to a partner in the UK.
Yeah.
I mean, we'd be able to potentially, if you send us more information about what you're planning to do and your institution, link you to people who might be able to help or partner with you.
Okay.
So if you send us an email,
yeah,
with more information about your organisation and what you'd be planning to do,
yeah,
we could see if there's anyone who would be relevant among our existing contacts.
Okay.
Yeah.
Thank you so much. Can I just send it the same way I send my question?
If you send us by email, to agp@fet.org.
AGP what?
agp
Yeah.
at fet.org.
Yeah. Okay.
It's on the screen.
Okay. Thank you.
Thank you.
Thank you very much.
Thanks. We have another hand raised by Alia Ahmed. So Alia, I'm just going to promote you to panelists and then unmute you.
Hi.
Hi, Alia.
Oh, great, that works. So this, I don't know if this is in the FAQs, but it seems like an obvious question, but I just wanted to double check. We've submitted, I'm from the WFSA, we've submitted proposals under HPS, and I just wanted to check if our proposals are unsuccessful under that funding stream. Is it worth applying for the same project under AGP, or would it, or would that not make sense?
Hi, Leah. It's a good question. First of all, I wanted to say that this call is open to applicants that have applied under the HPS as well.
Okay.
But maybe what my advice would be, if you want to submit the same project, is to maybe wait to receive feedback.
Yeah, of course, yeah.
And use that to inform another application for the same project.
Okay.
But it's nothing stopping you to send an application to the HPS and Africa Grants Programme.
Okay, great. Thank you.
And hopefully the timing of the call, the closing date, mid-November.
Yeah.
By end of October.
The timing works, definitely. We were just thinking about if it doesn't get accepted under HPS, if that was because it wasn't the right kind of project, or it didn't fit the criteria, or for whatever reason. But the helpful thing is that the timing makes sense, so that we're not scrabbling to make decisions. Okay, thank you.
Thank you. Right, shall we go back to some of the written questions? Do you want to take one, Paris? One moment.
So the question from Robert, can the partnership be three-way, e.g. a lead UK partner, an in-country African partner, and a lead partner in another non-UK and non-Africa partner? Well, you can have a UK lead partner, an overseas lead, and an additional partner in either the LMIC country we're working with or in the UK. So I hope that answers your question.
So you're talking about a lead partner in another non-UK and non-Africa, non-UK. So you need a lead partner in the UK, as Paris was saying, but a lead partner also in the low middle income country, African country. Yeah, and then you can have as many additional partners as you need, whether they're in the UK or in Africa or elsewhere.
I think it's mainly as long as you can show that they're supporting the lead UK partner and the lead low and middle income country partner in Africa and fit with the project, then I don't see why you couldn't have other supporting partners that are not African partners per se.
Okay. So we've already answered questions about whether FET can link organisations between from the UK to low and middle income countries. So as I said, if you do have a question about this, send us an email to agp@fet.org. We might be able to put you in touch with some of our existing contacts, but then the rest will be up to you.
So we have a question from Ian Holtby, would a community grant be applicable to community hospitals, as these are usually the first protocol for patients that are not resident in an urban area? Yes, I think that's fine, because they could be an organization or a health facility of some kind. So I don't see that as a restriction in this call.
Okay, I'm going to take a few more questions if people have hands up. So there's a question from Gift Minja. So Gift, I'm just trying to promote you to, oh, okay, Gift has gone. So we'll move on to Rose Gahire. Rose, I'm promoting you to panelists. Okay, sorry, we'll start with Gift. The technology was being a bit slow, so Gift, I'm just going to unmute you now. Hello?
Hello, hi.
Hi.
Yes, I need to know that will you provide another chances for theater staffs or nurses to apply, or we have to apply on this one?
Sorry, what's the question? Sorry, we're losing you a bit.
Is theater staffs to apply?
If I understand your question correctly, Gift, maybe just to clarify that this call is sent for volunteer bursaries, which FET has provided in the past to specific health workers that have a link to the projects that we have supported. So this call needs to include health institutions applying together, and we assume that there will be individuals within those health institutions that would be involved in the project, but it's not targeting specific health workers.
Okay, thank you.
Okay, thanks, Gift. Okay, I'm going to unmute Rose, and Rose, you can now ask your question.
Hello.
Hello.
Good afternoon.
Good afternoon.
Now, my question is that if we don't have like a ready pattern in the UK, but there is a big organization like which can be a lead in Africa, can that be possible?
You would need to have a partner organization that's
in UK.
Based in the UK or in Ireland. So
how do we get them?
Well, that's the question. Yeah. Either through your existing contacts, or again, if you're looking for one, you can always send us an email, and we can try and put you in touch with people we know that might be interested.
Yes, I will send a message, and then you see if we can have it.
Okay, thank you. Look forward to receiving it.
Okay.
As we've got a question from Mohammed Sadiq. Can one partnership submit more than one application? Yes, you're more than welcome to apply for more than one application, but just to manage your expectation doesn't mean that both of them will be successful. So I would recommend really kind of within your partnership, seeing whether it's worth applying for two or just really focusing on one to give you more chance of being successful. Because we have limited amount of funding, and we would like to make sure that we can give as many different partnerships and opportunities. So just bear that in mind, Mohammed.
We have a question from Andrew Mortimer. You say that you are expecting a large number of applications. Can you tell us how many you received last year and the total amount of money available this year?
So I believe we received around 200 applications last time, and 7 projects were funded. This time we have a little bit more money in the pot, so we expect to fund a few more, but it won't be much more than 10 to 15 maximum. Some of that will depend on how large the budgets are that the grant applicants are applying for. So that's a factor. So it is a very competitive process. But I think that part of that is because there's so much flexibility in the Africa Grants Programme in terms of the partnerships that apply and the projects.
Yeah, I think although we had 200 applicants, we also got quite a few that weren't eligible, so it kind of took us down to more of the 100, 130 mark, if that reassures you. The question from Tom Owen: what constitutes a track record with an LMIC partner? Do we need an MOU or similar to evidence of engagement through a needs? Is evidence of engagement through a needs assessment okay? So I guess again, we're a bit more flexible than the health partnership scheme in terms that applications from relatively new partnerships would be acceptable. And you know, letters of agreement and plans to sign an MOU as soon as the funding's awarded, I think would be acceptable. Whereas for the health partnership scheme call, we're looking to fund really established partnerships. But obviously, you know, we are going to also assess the capacity of your partnership to deliver the project. So some sort of track record of working together is quite important in that respect.
So I have a question statement from Robert saying, thank you. The third country is not a lead partner, but a supporting partner. Yes, so as we said, and this is also to answer Rose's question about you are talking for a lead partner in the UK. Is it possible to have a lead partner in Africa? So the partnership requirement is we need a UK lead or island and a low middle income institution as a lead partner, and then you can have as many additional partners as Sophie mentioned. I'd recommend looking at the grant core and Q&A, which does go through a little bit more about health partnership and what that entails. So please have a look at that, because that has all the answers that you need. And if you do have any more questions about that, please let us know.
Thank you. All right, so there's a hand raised by Susan Mumford. So Susan, I'm just going to promote you to panelists. And you are now unmuted. You can ask a question.
Hello, and I think you may have answered the question already. We have a memorandum of understanding with an institution in Ethiopia, a non-government organisation, and a further NGO in Ethiopia has approached both ourselves in the UK and this NGO in Addis to provide some palliative care teaching. So what I was wondering is if we link with our already established partnership in Addis, if between us we then provide the teaching to this further NGO, which is outside Addis, would that be an acceptable way forward for this application?
I think so. Are you providing training to health workers in a health institution?
Yes, I think so. I don't know a lot about the institution that's approached us for training, but I think they're community healthcare workers in a small rural town outside Addis. And earlier in the year when they approached us, there wasn't enough funding to provide that, but this grant might now provide the wherewithal for us to go out and do the training.
I think that would be fine, but maybe when you have more information, just drop us an email.
Yeah, I mean, we don't have any kind of memorandum of understanding or know much about the organisation who's approached us for the training, but as I say, we do have an established link with the hospice in Addis itself.
Okay, well, it sounds like it would be, but yeah, if maybe once you have more information on that institution, you can approach us again, and we can, with more information, we'll be able to confirm whether
Okay. So I could email you on the agp@set.org.
Yeah, absolutely.
Okay. I mean, we're going to be in Addis next week, so that will be a good time to just gather more information and see if we've got the appropriate criteria to apply.
Okay, great.
Thank you.
Right, I'm just checking if we have more questions. We also have some interaction in the chat function. Which I think some of them we've already answered. So there's one from Andrew Mortimer, who says, innovation is neither asked nor one of your assessment criteria. Are you looking for tried and tested methods only? No, it can be innovative, or it could be tried and tested. It's just not part of this grant call, which obviously it is for the HPS, but not for this call. I think what we're looking for first and foremost is whether it's appropriate to the local context and can be realistically implemented. Yes, Colette, I will be sending the slides and also the recording, maybe not today, but at least tomorrow, to everyone who attended but also registered for the webinar.
We have another question from Obina. Is there a need for shared funding, or can we expect all required funding from THET if less than 50,000 budget? No, there's no requirement for shared funding, and if your budget is within the criteria of the grant, which is 15 to 50,000, then yes, yes, the entire funding for the project can be applied for through this grant call.
Thank you. Okay, I'm just going to check for any more questions. There's another question from Andrew. You say a project must have a purpose on its own and not form an element of a wider project. Can you say more? As established partnerships have medium and long-term goals, and projects are likely to be linked to these program goals.
I suppose the reason that we put that into the call is because we're not asking for a program per se which has several projects within it. We'd rather want a straightforward project that's time-bound, that has clear roles and responsibilities within that project. But we do understand that partnerships have other projects that they are working on within the wider vision of that partnership, and that's fine. But what we're asking for is a clear plan from start to finish, and clear objectives related to a particular project that will form part of the wider work of the partnership. I hope that answers your question.
Yeah, I guess we're looking to fund projects that have a specific goal on its own, and not just to kind of combination of activities. Yeah, it needs to be a specific project, even if it's part, as Marta said, of a wider strategy and a wider program of work. Okay, I'm just checking if we have any more questions. I think Colette has another question. So Colette, I'm just going to unmute you again.
If we are an education organization or an education institution, can we also have an education institution as partner or research education institution as partner in UK?
Yeah, you can have a UK education institution.
Okay, what education institution?
Yeah, yeah, that's possible. Yeah.
Okay.
So if you look at the form, I'll get it up on the screen. There's a section on page 3 where it's a tick box basically, 2 points.
Okay.
And you just have to, as long as you meet any of those. If they're not in the list, then probably not eligible. But you know, you just tick which ones apply. So you could definitely have one Leeds UK or Irish health education institution and one Leeds institution.
Okay. Thank you. Thanks so much.
Thank you. Right, well, it looks like there's no other questions, and it is now just past 1 p.m. in the UK. So I think we're going to stop there. If any other questions come to mind, so I'm just going to unmute some people who want to unmute. Yeah, so if any other questions come to mind, please feel free to email us at agp@fet.org, and we'll be happy to answer your questions if we can. And as I said, I've recorded the webinar, and we'll be posting our recording on YouTube, and it will also be available on our website, and also emailing it to everyone who registered along with the slides. So thank you very much for attending this session. Hope it's been helpful, and we look forward to receiving your applications. Thank you. Bye.